Good afternoon, everybody. I'm Sayukta from beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. Few of the very common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne is a common skin condition that can impact anyone, whether you are a teenager or an adult. This skin complaint is no stranger. Knowing the various types of acne can actually help us to treat the condition better. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. It is one of the most common diseases affecting humanity and quality of life. It goes beyond just being a skin ailment to various psychological disorders such as depression, anxiety, stress, low self confidence, etc. Hence, it is important to know about the holistic treatment approach for this ailment. So today we'll talk about acne management. We'll get to know about it through an expert. So let's connect today with our skin expert, Dr. Srishti Dubey Mishra. She is joining live from Raipur to talk on acne management. Dr. Srishti is an ambitious dermatologist, cosmetologist, and hair transplant surgeon dedicated in providing safe, efficient, and patient centered care. She has more than 7 years of experience. After completing her MBBS from Kasturba Medical College, Manipal, she did her MD in dermatology from JSS Medical College, Mysore, and fellowship in aesthetic dermatology and hair transplantation. She is skilled in both clinical and aesthetic dermatological treatments. A very warm welcome to you, Dr. Shrishti. It's such an honor to host you today.
Hello. Hello.
So today we'll talk on acne management, and as I have already mentioned, acne is one thing which impacts almost everyone. I think almost all of us has gone or will at certain point of time go through that phase, and we know how depressing it is to have acne. So first of all, doctor, what is acne? Acne hota kya hai?
See, acne is a skin condition. It's a very common skin condition. I would not say that it's a disease because it's just a condition. Almost everyone will be having acne at some point of their life. So it's a very common skin condition which happens when your hair follicles, which are present in your skin, they get plugged with excess sebum production or keratin increased dead cells, inflammation of the skins, or sometimes bacteria act on the hair follicles. These factors leads to acne production. In simple terms, it is known as pimples, or in Hindi we call it muhase. So acne, pimples, everything is same.
Okay. And we also know, when we get acne, there are various patterns in which we get it. Many a times we'll get acne on our forehead. Many a times we'll get around the jawline. Many a times in the butterfly areas. And people say that, the pattern do suggest that what cause is behind that, the pattern do suggest the cause as well. So what's the correlation, doctor?
See, when the acne is predominantly on the lower face, so it is most commonly due to hormonal issues, like women who are obese, who have PCOD issues, who have diabetes. Those people get acne on the lower face. On forehead acne can be caused by dandruff in your hair. It can be caused by some fungus causing your dandruff in your hair. Okay. The other things, acne because of a lot of stress and your diet issues. Because of that, acne will be seen on your cheeks and your nose. Sometimes rosacea can be there, which is a different condition other than acne. There you get mostly on the central face. The reddish raised bumps, pimple kind of lesions will be seen on the central face. So in these conditions, we can see acne.
राइट तो अलग अलग जगहों पे अलग अलग पैटर्न जो होते हैं वो कहीं ना कहीं एक कोरिलेशन बताते हैं कि किस वजह से ये एक्ने हो रहे हैं बट ओवरऑल विल आल्सो लाइक टू टॉक अबाउट द कॉजेस आपने थोड़े बहुत कॉज मेंशन किए ही जब हमने पैटर्न की बात की बट ओवरऑल डॉक्टर व्हाट आर द कॉजेस द मेन कॉजेस रिस्पांसिबल फॉर एक्ने
See, exact cause we do not know the cause of acne. But mainly because the acne is most commonly seen in teenagers, in adolescents. So because of hormonal issues, hormonal changes in the body, that causes acne. Okay. Sometimes diet plays a role in acne. Okay. High glycemic index diets, which the diet which causes a spike in your blood sugar, that can cause acne. Sometimes women who have PCOD issues, obesity, that can cause acne. Okay. In males who do a lot of weightlifting exercises, they take a lot of whey protein and steroids, that can increase acne. Sometimes stress, a lot of stress in your life, that increases your cortisol levels in the body, and that can in turn lead to inflammation and acne production. So all these factors lead to increased sebum, that is oil production in the skin, causing acne.
So, n number of causes could be behind
Yes.
acne formation.
Right.
And for the proper diagnosis that why we are getting acne, we need to go and consult a qualified dermatologist. So, it's really important. And of course, we'll talk during the session about why it's so important to go to the doctor and not go for anything else or self medication, etc. But before that, doctor, we see various types or grades of acne. Many a times it's just blackhead or whitehead, what we as laymen call them, or they are cystic, or they are full of pus, they are really big nodules. So, what are these various types of acne lesions?
The acne lesions, starting from the basic lesions, we have comedons. On in simple terms, we call it blackheads and whiteheads. So blackheads and whiteheads are comedons. That is, closed comedons are whiteheads and open comedons are blackheads. So this happens when your sweat gland, sorry, or your sebaceous glands get plugged with oil, increased sebum production, or dead skin. There's no inflammation. There's no redness in these lesions. Okay, the white bumps or the black bumps on your skin. Second lesions are the papules, where there are reddish raised bumps on the skin, and mild pain might be there, redness might be there. So those are papules. Third lesions are the pustules, where the lesions are filled with whitish or yellowish pus. Okay. Then next lesions can be nodules, where the lesions are lumpy and they are deep, situated deep inside the skin. Okay, and there might be a lot of pain associated with nodules, and these lesions can cause a lot of scarring after the acne. Okay, the last lesions are the cysts, which are situated very deep inside the skin, and they are filled with a lot of pus, and they are soft to touch, and they are very painful. So these nodulocystic acne can cause a lot of scarring and pigmentation after they resolve. So these are
Okay,
the types of lesions we can.
right. And I'm sure those who had gone through the phase of acne, acne vulgaris, etc., will agree with me that treating acne is one thing, and treating the, scars or
Scarring.
pits or marks caused by acne is another. And many a times it looks like treating acne is much easier than
Easier
treating
than
the.
treating these scars. Yeah.
Right, we'll talk on that as well. But before that, doctor, because in our society, we are obsessed with our kitchen materials, haldi, turmeric, besan, or multani mitti, and we would love to apply them on our face. And home remedies are one big thing that we are all obsessed with or have a lot of trust on. So, are these home remedies okay? Especially in case we are getting these acnes, or why it's so important to go and consult a doctor before or rather trying these, home remedies.
See, I have seen in my practice most of the patients, they'll try home remedies and then come to us.
Right.
So they'll apply toothpaste on their acne.
Okay.
They may
Hmm.
apply baking soda, turmeric, haldi. They may apply multani mitti. Sometimes they apply lemon on the face, tomato, potato, whatever they get, they
Garlic
apply.
as well. I've seen many
Right.
people applying
And
garlic on their.
these things can cause a lot of irritation. In turn, these things can lead to irritant dermatitis. They can worsen your acne. So it is very important not to try these things. One thing some people can try is, if they have a lot of oily skin or excess oil production, they can try clay mask. but not regularly. Once in a week is fine because it can dry out your skin, and dry skin can in turn lead to increased oil production, leading to acne. So these things should not be tried. Even over-the-counter creams should not be tried. Those creams contain steroid. Most of the creams, names such as Betnovate, Panderm, Skin Shine, Skin Light, all these products contain steroid and they can worsen your acne and leading to other side effects.
My second question was related to over-the-counter topical creams only, because after home remedies or after failing in home remedies, the second most common thing that we love to do is to go to a chemist shop, get a over-the-counter topical cream, and start applying it. And many a times we have seen, as you said, that they have more side effects than but initially what happens, doctor, they work wonderfully and we get addict to those creams, or
Yeah,
our skin
initially,
get addict, right? So what's the whole logic behind that, and how harmful
see, what
these
happens
topical
is
creams can be?
most of these creams contain topical steroids. Steroids, it reduces your inflammation, it reduces the redness, it reduces the symptoms. So the patient feels that the cream is working wonderfully. So as soon as they stop the cream, the acne worsens a lot. They'll get a lot of acne lesions and other side effects also happen. They'll get redness over the face, irritation, itching, the skin thins out, the veins, the blood vessels on the skin become visible. They might have more hair coming over the skin. So all these are side effects of steroids. So I would advise never use over-the-counter topicals.
राइट और इसीलिए शुरुआत में मैंने कहा था कि हम इस सेशन में ये भी समझने की कोशिश करेंगे कि सबसे पहले एक्ने के केस में या स्किन से रिलेटेड कोई भी प्रॉब्लम है तो सबसे पहले डर्मैट के पास जाना क्यों जरूरी है। होता क्या है, हम ये होम रेमेडीज या ओवर द काउंटर मेडिकेशन में अपना एनर्जी, टाइम, मनी एंड मोस्ट इम्पोर्टेंटली अपने हेल्थ को, अपने स्किन को स्टेक पे लगते हैं। अल्टीमेटली डॉक्टर के पास जाना ही पड़ता है, लेकिन जब तक इनमें हम अपना जितना वक्त जाया करते हैं और जिस तरह के साइड इफेक्ट्स होते हैं, ऐसे में जब तक हम डॉक्टर के पास पहुंचते हैं हमारा ट्रीटमेंट का लेंथ बहुत लंबा हो जाता है। तो जो चीज बहुत आसानी से सॉल्व हो सकती है, ट्रीट हो सकती है, कंट्रोल हो सकती है, वो बहुत लेंदी हो जाती है, सिर्फ इसलिए क्योंकि हमने ये होम रेमेडीज या ओवर द काउंटर टॉपिकल एप्लीकेशंस किए थे। So please don't go for those, end up saving your energy, your time, your money, and most importantly, your skin, and go and consult the dermatologist, a qualified dermatologist, before everything else. ये भी आजकल बहुत कॉमन है अगेन डॉक्टर, बिकॉज वी हैव सो मेनी सोशल मीडिया इन्फ्लुएंसर्स एंड दे हैव सच क्विक फिक्सेस और गुड quick remedies for almost every problem. So again, what's your take on those? Plus they keep on endorsing a lot of products, and market these days are flooded with products. So स्किन केयर के नाम पे, एक बेसिक रेगुलर स्किन केयर के नाम पे हम लोग के पास 50-50 स्किन केयर प्रोडक्ट्स होते हैं और हम सब उस पे हेड एंड ट्रायल करते रहते हैं। आज ये अप्लाई कर लिया, कल कुछ और अप्लाई कर लिया, तो ये एक फ्रेंजी भी बहुत ज्यादा बढ़ रहा है। So what's your take on that?
These days, more than dermatologists, these skin influencers have increased. So every day they'll put new videos. Acne के लिए ये treatment करें, pigmentation के लिए ये treatment करें, DIYs, do it yourself, all these things. So you should not follow all those things blindly. Okay, most of these skin influencers already have a very good skin, so they don't understand what an acne patient is going through. So you should not follow all these things. Okay, they'll tell you to apply curd or haldi, or sometimes a lot of different products. So you should not follow. You should just go to your dermatologist and do what the dermatologist advise.
Right. The bottom line is don't fall for these market gimmicks. ये सब market oriented है. Please, आपके skin को risk करके कोई अपना business कर रहा है, right? So don't go for that. Go to a doctor. और कई बार ये होता है जब हम किसी से पूछते हैं कि अरे इतने ज्यादा एक्ने हो रहे हैं, डॉक्टर को क्यों नहीं दिखाया, तो वो कहते हैं अरे डॉक्टर केमिकल नहीं लगाने हैं अपने स्किन के ऊपर, या डॉक्टर केमिकल्स वो कर देंगे, but the fact
People are
remains
very scared of applying
हाँ,
chemicals.
अल्टीमेटली हम केमिकल्स यूज कर रहे हैं बिना जाने, स्टेरॉइड्स यूज कर रहे हैं रादर बिना जाने कि वो कितने खतरनाक हो सकते हैं। तो ऐसे में बहुत जरूरी है कि हम एक क्वालिफाइड डॉक्टर के पास जाए, बिकॉज उन्हें पता है कि वो क्या दे रहे हैं, क्या प्रॉब्लम है, उसका रूट कॉज क्या है, और उस तरह से वो अपना डोसेज और सारी चीजें आपको बताएंगे। सो प्लीज गो टू अ डॉक्टर एंड ट्रस्ट योर डॉक्टर, दैट्स इक्वली इम्पोर्टेंट।
Exactly.
नाउ कमिंग टू द ट्रीटमेंट पार्ट डॉक्टर, व्हेन अ पेशेंट कम्स टू यू, what all ways are there to diagnose the cause? तो किस तरह से ग्रेड या कॉज ये आप पता करते हैं और उसके बाद किस तरह से ट्रीटमेंट आप देते हैं?
See, actually, there are four grades of acne, starting from mild to severe acne. So, grade one is when you have predominantly comedons, that is blackheads or whiteheads, and few papules might be present. Okay, grade two is when predominantly papules are present. Okay, reddish raised bumps are present. Few pustules, pus-filled lesions might be there in grade two as well. In grade three, predominantly pustules are present, and a few nodules might be present. Grade 4 is very severe form of acne, that is a nodulocystic acne, where you have a lot of nodules, cyst filled with blood, a lot of redness, inflammation, and pain is present on the face. So that's how we grade the acne. According to grade, we can have an idea of the cause of acne as well. Okay, mild, when a person is having a nodulocystic acne, there might be more inflammation in the body. So there might be more of hormonal changes in the body. Okay. So in a female, we can diagnose PCOD based on the grade of acne. We have to do some tests, some blood tests, hormonal tests. We have to do ultrasound. So polycystic ovarian disease can be diagnosed. Very common. Acne is very common in PCOD patients. Okay. And other than that, as I said, it's a very common condition. So always it is not important to diagnose the cause of the acne because it is a common condition. So it's not always important to diagnose the cause of acne. It might be present because of the normal hormonal changes a teenage is going through.
तो जो ट्रीटमेंट होता है डॉक्टर, व्हाट ऑल कंटेन्स, उसमें क्या क्या होता है?
The treatment, I advise according to the grade of acne. So initially, when the patient is having very few comedons, blackhead, whiteheads, there's no inflammation, there's no redness, no pain on the face. So my choice of treatment is topical retinoids. So what are retinoids? Retinoids are vitamin A derived compounds. Okay, there might be a lot of retinoids like tretinoin, adapalene. Now trifarotin has come, new retinoid has come. So that is my treatment of choice for mild acne. Okay, when there is little inflammation, then we can add other compounds like benzoyl peroxide, okay, clindamycin. Okay, these are the topicals. When the grade increases, we have to add oral drugs also. Oral drugs, we can give oral antibiotics like tetracycline antibiotics are most commonly used like doxycycline, minocycline, limecycline. Other antibiotics can also be used. Okay, and when there is severe acne, then in addition to the topical treatment, we have to give systemic isotretinoin also, which is a systemic retinoid, vitamin A derived isotretinoin. So that's how we give the treatment, the topical and the oral drugs. In addition to these treatments, we can do the in-clinic procedures as well.
Okay. राइट। अच्छा, हम एक्ने पर बात कर रहे हैं और इससे हमने पहले बात की कि किस तरह से बहुत जरूरी है कि हम होम रेमेडीज, क्विक फिक्सेस, ओवर द काउंटर मेडिकेशन की तरफ ना जाके डॉक्टर को दिखाएं। एक और गलती, बहुत आम गलती जो हम करते हैं और हमें पता है कि सब लोग मना करते हैं कि ये नहीं करना, दैट इज प्रिकिंग द एक्ने और द पिंपल। और हमको लगता है कि इसी से हमारा एक्ने ट्रीट हो जाएगा। देयर आर मेनी पार्लर्स और सलून्स जहाँ पे अगेन दे ये राइट, दे विल prick these. We also on our personal basis can do that. How harmful can pricking be?
It is very harmful. I know बहुत ज्यादा मुश्किल होता है पिक ना करना acne. बहुत ज्यादा मन करता है to pick the acne,
right,
but you should avoid that because क्या होता है when you pick the acne, the inflammation, the excess bacteria that go inside, that will go inside and that will cause more inflammation inside the skin, deep inside the skin, and that can lead to acne scarring. So that increases your scar formation. When you pick the acne, that increases your pigmentation. When the acne resolves, there's more pigmentation, there'll be more scarring formation. So you should avoid picking the acne, and you should avoid going to the parlors for extraction of the acne. You should always visit a dermatologist for extraction of the acne. That is, the technique of extraction of the comedone is very important. Okay, which
Right.
the parlor person, they don't know the technique. Proper technique is not known.
Right. तो हमने बात की किस तरह से एक्ने का ट्रीटमेंट होता है, और जैसे कि पहले हम बात कर रहे थे हाउ डिफिकल्ट इट इज टू ट्रीट और टेक केयर ऑफ द पोस्ट एक्ने पिगमेंटेशन और मार्क्स और स्कार्स और पिट्स। तो ऐसे में जो स्कार्स, मार्क्स, पिट्स, ये जो एक्ने छोड़ के जाते हैं, इनके ट्रीटमेंट के लिए क्या किया जाता है? आई एम श्योर लॉट ऑफ प्रोसीजर्स आर देयर,
Correct.
राइट? सो व्हाट
Correct.
ऑल can
See,
we
there
do?
are a lot of procedures which we can do. First of all, in acne itself, we can do some procedures. So if the patient is having predominantly comedones, the blackheads, whiteheads, we can do comedone extraction. We can just remove the comedone. So that will treat the comedone. In addition to that, we can do the chemical peel procedure. It's the most common procedure done for active acne lesion. Okay, a lot of peels are there. Most commonly used is salicylic acid peel. Okay, what we do is we apply the solution, we keep it for 5 to 10 minutes, and we just remove it, and we can use a mask over it to soothe the skin. Okay, so salicylic acid, what it does, it dries out your acne. It dries out your excess oil production. It reduces the pigmentation also. So that can be done. Nowadays, new lasers have come for active acne. Okay, so Q-switched Nd:YAG laser, we can use a different mode is there in that, which we can use for active acne, which reduces the redness and it dries out your acne. Even intense pulse light can be used for acne. Okay, different black peel is also there, which we can use for acne. Now, coming to the complications of acne, that is the pigmentation and the scarring which happens after the resolution of acne. So for the pigmentation, we can use various kinds of peels, like your glycolic acid peels, or now combination peels have come, okay, which has a lot of skin lightening agents. The patient has to come to the clinic and get it done once in 15 days or once in 3 weeks. Okay, that reduces your pigmentation and it also reduces the active acne as well. We can also do laser, that is Q-switched Nd:YAG laser, also known as laser toning, which reduces your pigmentation. It's a very good laser for your post-acne pigmentation. Okay?
Right.
Coming to the scars. So post-acne scar is a very common thing. There are different kinds of scars. Starting from the ice pick scars. Ice pick scars are very small but very deep scars. Patient can have, in the same face, they can have different kinds of scars. Okay, second one is rolling scars. Third is box scar. So different scars have different modalities of treatment, and we have to combine a lot of treatments for the effective treatment of the patient. Okay, so we can do for the ice pick scars, we can do TCA cross, in which we apply TCA, that is trichloroacetic acid, over these scars. Okay, that reduces the depth of the scars eventually. Okay, the patient has to get it done multiple times. Then we can also do some peels, which will cause resurfacing of the skin. We can also do MNRF, which is microneedling radiofrequency. Okay, that causes all these procedures, microneedling radiofrequency, simple microneedling, which is done with a derma pen or a derma roller, or fractional CO2 laser or erbium YAG laser. All these treatments, they are directed towards your increased collagen production. What happens when there is a scar? Collagen there is reduced. So what we have to do is we have to increase the collagen production from inside so that scar comes up slowly. So all these procedures are there for the scarring, and we have to combine different procedures in various sessions to get improvement in scarring. So it's a very long process to improve the scar. So that's why it is very easy to treat acne than scarring.
Right. And it's equally important to go to the right person for these procedures. Please go and consult a qualified dermatologist. Don't fall for saloon parlors or quacks, because they don't know the exact procedure. So please don't risk your health. Go to the right person, which is a qualified dermatologist. Um, we have a viewer with us, John Verghese, and his question is quite relevant. This is that are there any specific skincare routines I should follow for acne prone skin?
See, an acne prone skin can be an oily skin, it can be dry skin, it can be normal skin. So we cannot give a same routine to all the patients with acne. Some patients have sensitive skin with acne. So we have to tailor the routine according to the patient's need. Okay, if the patient is having very oily skin, we have to give a cleanser which has salicylic acid, a foaming cleanser. If the patient is having dry skin, a gentle cleanser is used. Okay, and according to the grade of acne, we have to use. See, always you should use sunscreen when you have acne, and moisturizer should also be used. Even if you have oily skin and oil-free, non-comedogenic moisturizer, we have to see all the products for the person who has acne should be non-comedogenic. It is very important. So
Right.
that's how you should decide your products.
Right. Many times, again, we have this tendency in our head that, or notion in our head that oily skin means, or acne prone skin is the one where you are not cleaning your skin properly. So many a times, especially those who have oily skin, end up washing their face n number of times. Every now and then, they'll
Yeah.
wash their face with a cleanser because their notion is that with cleanser, I'm getting rid of all the oil, and thus my face is acne free now. What's your take on that, doctor?
That should be avoided because when you have oily skin, you tend to wash a lot of times. That tends to dry out your skin. So when the skin gets dried up, there is reflex increased oil production. So whenever if you are washing your skin multiple times, your oil production will increase and in turn your acne will increase. So always avoid multiple times washing your face. Okay, just 2 times washing your face is enough. Okay.
Okay. And what's your say on the usage of sunscreen on a regular and liberal manner? How important is sunscreen in maintaining a good skin, a healthy skin, and an acne-free skin?
See, many patients, many acne patients, they think that sunscreen will increase the oiliness and that will cause your pores to block and increase the acne production. Some patients think that sunscreen makes them look dull, and increase the oiliness of the face. So it is not like that. Sunscreen should be used even if you have oily skin. The important thing is the sunscreen should be non-comedogenic. It should be gel or aqueous based sunscreen. It should be lightweight. It should be 30 or more, 30 or 50 SPF and PA factor 3 plus. So sunscreen should always be used. What happens is when there is increased sun exposure, that causes increased free radicals on your skin, which in turn causes increased inflammation and acne. The second thing is sun, if there is no sun protection, increased sun exposure can lead to increased pigmentation, which happens after acne. So increased chances of post-inflammatory hyperpigmentation happens when sunscreen is not used properly. So sun protection is very important in case of acne.
Right. A similar question has been asked by Ajit Narayan Ocha. That is use of sunscreen mandatory in acne. I'm sure you have got the
Yes.
answer. We have Sohana Thakur with us, and her question is there a long term plan for managing acne, or will it eventually go away on its own?
See, if you have acne during your teenage, that is because of your hormonal changes, which is happening during your teenage. Eventually, it goes away. But sometimes it might turn to adult acne. So, for every individual, it is different. Sometimes the acne will go away on its own, sometimes it has a long term impact. Okay, so we have to treat accordingly. Teenage acne is treated differently, adult acne is treated differently. So, accordingly, we have to treat. There's no one rule for everyone.
Right. We all know that, diet plays an important role. Initially, you also said foods that spike your blood sugar will can cause acne. Are there any dietary precautions, do's and don'ts that we should follow?
See, diet has no direct role in the causation of acne, but few studies have found that most importantly, the diet which has a lot of a high glycemic index, which spikes your blood sugar, like your white bread, white rice, high sugary items, okay, then sweets, chocolates, all these things can lead to increased blood sugar immediately after eating. So that increases your insulin like growth factor in the body, which causes increased inflammation in the body, inflammation in your skin, and that can result in acne. Some studies have found that cow's milk, because of certain hormonal factors present in the cow's milk, that can cause increased acne in the skin. Okay, and diets which should be taken for acne prone, which are good for acne prone skin. So what I say is the diet, what you eat for what is good for your heart is good for your skin.
Okay.
So you should have low glycemic index diet. The diet which is taken by diabetic patients, like your whole grains, okay, your legumes, colored vegetables, green leafy vegetables, orange colored vegetables, yellow colored fruits should be taken. Berries, which are high in antioxidant levels, should be taken. A diet which has a lot of, good fatty acids, good fats should be taken. Omega-3 fatty acids like your seeds, nuts. If you're non-vegetarian, fish is very good. Eggs are good. Okay, lean meat can be taken. So these diets are really good for acne.
Right. So now at least we know what to eat, what not to eat, what to do, what not to do. We have one more viewer with us, Firoz Khan, and I'm glad that men's are equally participating in this session and asking questions, because a very normal notion is that acne is only women's trouble, which is not true. Men's, boys, they also get
Actually, boys are having more acne during that teenage.
Okay. Right. So I'm glad they are also equally participating. So Firoz Khan question is, when should I schedule a follow-up appointment to access the progress of my acne treatment?
To access the, sorry, I didn't get you.
When should I schedule a follow-up appointment to access the progress of my acne treatment?
See, it depends on the doctor. Some doctors give you treatment for a month. Some doctors give you treatment for just 15 days and they ask you to come for follow-up. Sometimes we want to do a chemical peel. So we give your treatment for 15 days and we ask the patient to come back after 15 days to get the treatment done, but not more than 1 month. You should always follow up with the doctor within 1 month of starting the treatment. It is very important because we have to assess whether the treatment given is working or not, whether it is causing any side effects. So every skin is different. So within 1 month, you should visit the doctor.
Okay. We have Tina Bhargav with us. Her question is, how long will it take for my acne to improve with treatment? And what should I expect during the treatment process?
That again depends on individual to individual and depends on how severe your acne is. Do you have any hormonal issues? Right? If you have mild acne, within about 2 to 3 weeks, you will start seeing improvement. Okay. If you're getting any procedures done, chemical peel done, then again the duration will reduce. The improvement will be faster compared to home-based treatment alone. If you have severe acne, obviously the treatment duration will increase. And if we give isotretinoin, oral isotretinoin, initially there is flare up in few patients. Initially, first month, the acne might increase in few patients. So what happens? These patients usually stop the treatment. They get scared that this medicine is causing increased acne. So they should not do that. I usually tell my patient on the first visit itself that initially it might increase and then it will reduce. Okay, so slowly it will reduce. Isotretinoin takes time. So within 2 months, you will start seeing results. So
Okay.
acne actually, it's a long process. You have to have a lot of patience
Right. And we have a lot of questions on sunscreen. And one of the important question I think is which type of sunscreen should be used in acne? Again, when we go to get or buy a sunscreen, there are so many informations on the pack, right? So what are the basics that we should go for, especially in case we have an acne prone skin?
Right. See, sunscreen, there can be a lot of formulations of sunscreen. There can be cream-based sunscreen, lotion-based sunscreen, gel-based sunscreen, and now fusion water-based sunscreens have come. So if you have acne, you should always use a gel-based, lightweight, or aqueous water-based sunscreen should be used. You should never use a creamy or lotion or oil-based sunscreen. Secondly, there are two kinds of sunscreen in terms of the ingredient. There can be chemical sunscreen and physical sunscreen. So, usually most sunscreens have both the components, the chemical components and the physical components. Because if we have only physical sunscreen, it usually leaves a white cast on the face, which doesn't look good. So, if you have very sensitive skin, I would advise use only a physical sunscreen, which has zinc oxide or titanium dioxide present in the physical sunscreen. But if you have a normal skin with acne or oily skin, you don't have a sensitive skin, you can use a combined sunscreen. Then this SPF is very important. How much SPF is there? For Indian skin, SPF 30 is enough. 50 is even better, but 30 is enough. So it should be above 30. Some makeup products, foundations and all, they have very less SPF, 15 and all. So you should not just use those things. They will not protect your skin from UV rays. Okay, and even PA factor is important. PA factor is which protects from the UVA rays. Okay, so PA 3 plus should be present. So these are the factors you should look for when choosing a sunscreen.
All right. Or else you can definitely go to your dermat and ask for their suggestion, take their advice. That's equally, that works really well. Now, doctor, because we are talking about acne treatments, and we have already spoken a lot about the dietary part or the dietary modification that we can do. Now, what are the other lifestyle modifications that we can do for acne-free or, preventing acne?
First of all, as I said before, that stress is related to acne. So you should try to reduce stress in your life. Okay, have a good 7 to 8 hours of sleep. What happens is when there's increased stress in the body, the cortisol hormone levels increases in the body, which leads to increased inflammation causing acne. Right? Even sleep, when you have a good sleep, the cortisol levels reduce and the acne production reduce. That's why we call it beauty sleep. Okay, right? Then when always clean your face before sleep. Always clean your makeup before sleeping, because when you leave the makeup in your face, it can cause clogged pores and leading to acne. Always double cleanse. If you have acne prone skin, you should always clean with, first you can clean with a micellar water or cleansing balm or a cleansing lotion, and then use your regular face wash, right? Then you can also reduce your stress by exercising. Okay, exercise regularly. And you should clean your face before and after, immediately after exercise, because sweat, when you exercise, you have a lot of sweat, which can again lead to clogged pores and acne, right? Then again, I have told about diet, which is good for acne and which is bad for acne, right? You should always clean your makeup brushes. That is very important. You should not use the same brush every day, brush and your the sponge which is used for the makeup. Right. You should always clean your hands before applying anything over the face. You should clean your phone. The phone is has a lot of bacteria, virus, everything is there on your phone. Okay, right. You should always regularly clean your phone. You should change your pillowcase. That is also very important. Okay, because you'll be sleeping every night on the same pillowcase and you might end up having acne. Then again, you should never use harsh, scrubs on the face. That is very important. What people with oily skin do, they'll use, apricot scrub, or very harsh scrubs are used by them. These contain a lot of gritty, large, substances which can irritate your skin and in turn cause inflammation and acne. Because in acne-prone skin, skin which is having acne is already a sensitive skin. Because of inflammation, the skin barrier is already disturbed. So you should not disturb the skin barrier by using all these harsh products on this.
Right. Be gentle with yourself. That's the bottom line. Thank you so very much, Dr. Srishti. It was wonderful talking to you. Thank you for this very informative session. At least now we know that what to do and what not to do, and how important it is to go and consult a qualified dermatologist in the very first stage. Thank you so very much.
Thank you.
And viewers, thank you for your excellent participation in today's session. Stay connected to our beautiful Spotless Skin page. Stay happy, stay healthy, keep glowing. Goodbye. Have a good day ahead.